Hello everyone. Rishi Sunak's policies for the NHS have been marked by bold ambitions but significant challenges and missteps. Let's dive into the details and separate the rhetoric from the reality. First, the long-term workforce plan. Sunak's government announced a 15-year strategy, the largest expansion in NHS training history, aiming to double medical school and substantially increase nurse training slots by 2031. This move is intended to reduce reliance on international recruits and costly temporary staff. Yet, while this plan sounds promising, it is important to note that such long-term solutions will take years to materialize, doing little to address the immediate crisis facing the NHS. Waiting lists. Sunak pledged to reduce these lists, a promise that remains unfulfilled. The waiting list has ballooned from 7.2 million to 7.5 million under his watch. Critics argue that while Sunak touts reduction in extremely long waits, the median waiting time has actually increased. This suggests a deeper systematic problem that temporary fixes or isolated improvements cannot address. Perhaps Sunak is saving the actual reduction for his next campaign slogan, waiting list coming down eventually. Critics argue that while Sunak touts reduction in extremely long waits, the median waiting time has actually increased. Then, there is the issue of NHS strikes. Sunak's handling of strikes by junior doctors and other healthcare workers has been less than stellar. His administration has faced criticism for failing to effectively negotiate and resolve these disputes, further straining NHS resources and impacting patient care. While Sunak blames these strikes for the worsening waiting list, analysis indicate that these lists would have grown even without industrial action. Finally, there is Sunak's stance on private healthcare. When asked if he would use private healthcare for a loved one facing long NHS waits, Sunak affirmed he would. Now, this admission stands in stark contrast to opposition leaders who pledged allegiance solely to the NHS. This raises questions about his commitment to public healthcare and the equity of access for all citizens. In summary, Rishi Sunak's NHS policies are a mix of ambitious long-term plans and short-term failures. With rising waiting lists, unresolved staff strikes, and debates over the adequacy of funding, his approach to healthcare remains under intense scrutiny. The question is, can these policies deliver the promised transformation, or are they merely band-aids on a system in need of fundamental reform? Stay tuned.